So I chose this very important topic and a topic of my interest, that is cancer in the elderly, navigating the emotional and mental health challenges. So I'm Dr. Vinuta. I'm currently working as an assistant professor in the Department of Psychiatry at SDM Medical College, Dharwad. So I chose this topic not to bring negativity around by speaking about cancer in the elderly, but I wanted to the main aim of this presentation of my talk was to instill hope and optimism inside you. So in my first slide, I have put a picture of the whole world and 5 different places around the world, which are called the blue zones. So what are these blue zones actually? These blue zones are regions where a higher than usual number of people live longer than the average, and they are mostly about the age of 105 to 110-year-olds. So they are elderly people. They are considered to be one of the healthiest people in the world, even though they are elderly, right? So I want to instill this hope and confidence inside you that age is just a number, because people in these areas have been studied throughout the world that what is it that these elderly people, what are the lifestyles of these elderly people that make them really healthy and live them up to 120 years, 115 years. So these are Loma Linda in USA, Costa Rica, Sardinia, Icaria, and Okinawa in Japan. And I hope to see India being one of these places too for our elderly very soon. So with instilling a source of hope inside you, I'll now move on to the topic. So elderly, we know that elderly phase is a very different phase after we finish our middle age group, and then we move forward onto the elderly age group. And it's already a period of lot of changes inside your body and your mind already taking place, right? You know, there are personality changes inside you. Elderly, we don't like some things being going beyond our comfort zones that time, right? We sit and review our life that time, what all happened throughout our lives, right? Whether my life has been fulfilling or not, right? Once our children leave and go, what about the decisions? Who is going to take care of me? And all that sort of questions start coming up during this phase. But I've heard and I have seen that these elderly population have listened to their parents, and these are also the people who are listening to their children. So these are the people who are stuck in between both the places where they listen to their parents and they also listen to their children. So how do we make their life a little more easier? So this is my whole target. So you also reflect on your past decisions during this phase and whether there are fulfilled dreams, whether you're proud of yourself, whether there are any unfulfilled dreams, or whether there are any conflicts. So this is the time where you think about all of this. And during this time, which is supposed to be a golden period, there might be some challenges that come up, like um, cancer or any other disorders or diseases or illnesses in the elderly period. So I want you to know that mind and body are not two different things, right? When body is affected, your mind gets affected naturally. So let's move forward, all of us, by considering that the mind and the body are in synergistic with each other, in the sense that they work hand in hand with each other. They don't go separately. If something happens to the mind, something happens to the body. If something happens to the body, something happens to the mind. So it's important that we are aware of both these aspects. While I was undergoing a little bit of a YouTube channel about the different kinds of topics that have been spoken about in the elderly, not many people or nobody has spoken about cancer and how to navigate these issues in the elderly. So I thought that let me touch upon this, because there are two problems here. One is that it's a bodily problem. Cancer affects your body and it may affect your mind as well. So there are two things we are talking about today, actually, right? So coming on to my first slide, why cancer gets becoming more common in the elderly? Because aging leads to changes in our genes over time, right? Weaker immune system happens during the elderly, long exposure to risk factors. It could be unhealthy diet, it could be alcohol, it could be tobacco, it could be pollution. There are many multiple reasons why cancer can come up in the elderly. So just a few statistics for you to know that how many people are actually getting affected by this problem and why are we not talking about it, right? Why are we not really taking a step forward in this? So approximately you can see that 1.5 million new cancer cases annually, right? And more than 50% of these cases occur in the elderly groups. Lung, breast cancers, prostate, cervical, and oral cancers are the most common, right? So just to little bit keep it simple to know what are the different kinds of cancers that come in men and women. So mostly in Indian men, lung cancers most commonly seen, and it's linked to smoking and environmental pollution. And environmental pollution nowadays is becoming more and more prevalent. Prostate cancer. So it is one of the most diagnosed cancers in the elderly men. Mouth and tongue cancer, often linked to tobacco and betel nut chewing. Stomach cancer, more often due to our dietary habits and infections. So what about women, elderly women? Now you can see that breast cancer has actually overtaken lung cancer and women, and it is the most common cause of death in women. So it is very crucial to identify it. Cervical cancer, it is preventable through screening. Ovarian and uterine cancer, so it can get missed because not very typical symptoms come up. Lung cancer, again because of passive smoking in women. Someone who is smoking and that smoke enters your body, then it can lead to lung cancer. So how do we normally usually respond to a cancer? Because the word cancer itself is so huge that, you know, even if we are not affected, even if someone else is affected, and if we hear the word cancer, we say, you know, that's the sort of emotions it invokes in us. It's a huge word for all of us. And imagine if you, me, or any of our family members um, happen to have this with us, how difficult it can get and how difficult these emotional reactions can come up, right? So we can respond it with shock and denial. No, this can't be happening to me. This is not happening to me. This is the most commonly occurring emotional reaction. Fear and anxiety. Who will take me to treatment? What will happen to me in the hospital? How will I come and go to the hospital? What sort of medications are they going to give me? Will I be able to tolerate it? I already take so many medications. I have diabetes, hypertension. Will these medications affect that? Who in my family will take care of me? How will they navigate this problem? What if I become a burden to them? Sadness and depression, all these huge feelings can invoke overwhelming and make us feel hopeless. We don't find a way at times. And in the end, we might see acceptance and coping, adjusting to new realities with time. So what are some of the worries that are very specific to cancer? You know, you can constant worry about it recurring. You have treated, you've gotten well. What if it comes again? Can lead to anxiety and sleepless nights. So some of the coping ways would be to shift your focus on regular checkups, doing what is in your control. You can have regular checkups. You can calm yourself down with mindfulness exercises and focusing on healthy habits. We'll talk about it later. So there are some social stigma and myths in India which are very pertinent to cancer, and Forget about mental health issues and cancer. Just having cancer itself will shut the doors off for us to not talk about it, right? So, first myth is cancer is always fatal. Fatal by mean it always causes death. So, it's a myth. It's not true. You can survive having cancer. The second myth is cancer spreads by touching. No, it's not true. It ain't. It doesn't touch by spreading. Treatment is worse than the disease. Let me be with it and die without seeking any help because it's not curable. Treatment makes me feel worse than the having it, right? These are some of the myths in which we commonly come across, but these are actually not true. You can survive cancer, you can beat cancer, okay? And treatment modalities are way, way better and supportive for cancer now. Early detection and proper treatment improve survival rates. This is what I want you to remember. Some of the common methods that doctors use is through surgery, removal of the tumors, chemotherapy, where medications are given to kill the cancer cells. Radiation is given for targeted rays to destroy cancer. And immunotherapy, because we have to boost the immune system of the body to fight the cancer cells. So now, because of this treatments, you or any of your family members who have been suffering from cancer or seeking treatment for cancer might notice that they encounter a lot of fatigue, sustu, right? So this becomes a little difficult for them to handle. Okay, so sometimes what actually seems contrary, like there is already loss of energy, there is already fatigue, but a small amount of walk in the morning tends to shift your energy throughout the day. So, not very vigorous exercises, but just a 5 to 10-minute walk in the morning can calm down the fatigue. So, short walks can improve your energy levels, and especially the morning 8 to 10 a.m. sunlight. So, it tends to have a tremendous effect on your energy levels. So, having a short walk in the morning seems to be beneficial. Having a balanced diet, including proteins and whole grains. I'm sure we can have a huge discussion based on our various cultural backgrounds about different cultures, how different diets are celebrated in different cultures. So, but be it what, having more of proteins and whole grains are better. Having short meals frequently rather than huge meals is tend to be beneficial. Adequate rest, sleep, and short naps are very much important because it tends to conserve your fatigue, conserve your energy levels. So you can also see that nausea, vomiting, and loss of appetite are some of the common issues that you come across during cancer. So some of home remedies are also noted, and you don't have to always use medications for that, or you don't have to always seek help unless and until it's emergency. So small homemade remedies can also help with nausea. Small frequent meals prevent bloating. Hydration is the key to avoiding weakness, especially in the elderly. We elderly are more prone to develop hydration issues, dehydration, and electrolyte disturbances. Sodium keeps on varying in elderly. So hydration is the most important aspect here. Now you can see some of the people who have undergone cancer or they have undergone removal of those organs or surgically removed, even if the organ is not outside, even if the organ is inside your body, it tends to affect your mind because your mind and body are not different. Even if you can't see a body part externally, it is there in your mind. So whenever you get a body part removed, you can start feeling the sense of loss in that organ, right? Especially in breast cancer patients, women with breast cancer, once they would have fed their children with that breast, right? So it is of a very much psychologically important for a woman's body, and losing it can trigger a lot of difficult emotions. So body image issues and confidence tend to get affected quite much in the elderly and those with cancer. So the hair loss with chemotherapy is one such incident. And you can see how people are being supportive by shaving their heads off if someone is undergoing chemotherapy as a mark to show their support and care for them. Many other modalities like wigs, scarves are coming nowadays and embracing the new look. So hair loss is actually temporary and you get back your hair from the chemotherapy later. It's not a permanent damage. Surgical scars can remind you of that trauma you underwent. When you ever look at your body of the surgical scar, it can remind you of the trauma you underwent of the cancer. Beauty cannot just be physical. Beauty is internal and inner strength. So we need to remember that. So someone who's undergoing chemotherapy, especially, there are some changes in the brain that happen. It could be memory lapses, difficulty in concentrating, and it can be because of the different medications that are being fueled up inside your body. And more so because in the elderly, there are already a lot of changes in your brain in terms of cognition, in terms of thinking, in terms of memory. So because of the chemotherapy, sometimes there can happen that memory lapses and concentration difficulties start coming up. So using a daily planner, writing it down, making chits, staying organized, putting it on a board where you can easily see it every day can be some helpful strategies for overcoming this. Brain exercises like puzzles and reading can also help. Coping with anxiety and depression, definitely stress levels are higher. Some of the psychological modalities like meditation and mindfulness lower your stress levels. Of course, therapy, we are always available to come and talk. Counseling and support groups help process emotions. So there are some very specific groups where people undergoing a similar type of problem come together and share their experiences. So when you hear someone else sharing their experiences, it makes you feel you are not alone in this. And that is a huge pressure relief inside. So support groups and group therapies can be very much helpful. So you can see that talking about it, not hiding about it, is more helpful and therapeutic here. Engaging in hobbies is something that is very important in small manner. It need not be in a very huge extent. Very small things that you like doing, reading, or maybe spending time with your grandchildren, doing something for the society, or small watering in the garden, right? Reading any spiritual books that you like, doing puja, the way you find happiness and relief is very important to continue keep doing it. How family can be a support. So someone who is being present and listening, oh, don't think about all of that, you don't think only about all of that, might make us feel very unheard. Rather, having a listening ear to it is more supportive. Encouraging positive thinking. Encouraging positive thinking and helping with doctor visits and daily needs can be ways in which our family can be helpful. So how cancer can impact and already cause loneliness in the interactions. Am I audible? Hello?
You are audible, no problem. You are audible.
Okay, sir. Okay, sir. So how cancer and loneliness can impact the elderly? So lack of social interaction can worsen emotional health, right? Joining community groups and spiritual gatherings again is helpful. Video calls with family, if they are far away, can reduce some amount of isolation. And if not, there are already a lot of help, self-help and safe spaces available for you to talk. I would want to highlight one important thing here, that is keeping our mental health healthy is spirituality, especially in the elderly. So this is something that is been proven lot many times and seen a lot many times that faith can provide comfort and resilience. So don't lose this faith. Prayers and meditation, definitely a higher power, be it anything that you believe, tends to help in developing mental strength during these times. Engaging in religious rituals can bring peace. So what I have noticed, some of the barriers why people do not talk about it or why they don't seek help about this is that they think that it is shameful to have cancer in the family. It's not a shame. It's not a shame. And you don't have to undergo it alone. It's just like any other illness, like any other illness. So it is not a shame that you're bringing to the family. Avoiding mental health professionals due to stigma. Cancer always also has its own stigma, and mental health also has its own stigma and barriers to seek help. So we need to be aware about these things, that it can have a compounding effect. One can compound the other effect, and we might not talk about it altogether. So educating families and family members and people with these illnesses is very important. And Vayomanasa and all of you who are attending right now, you are actively taking a step in doing this. Maybe not for you, but anyone around you who are suffering from this. So encouraging such sort of activities is very important. So you can also see that cancer tends to mean that my life is come to an end, right? There could be a lot of fear about suffering, leaving your loved ones, right? And I think that this is a very valid concern. And there are a lot of treatment modalities and legal things that have come up that will ensure that you do not have to suffer in this. It ensures dignity and your comfort. Your comfort and dignity is taken care of. Sharing life stories can create a sense of fulfillment. If you can see that previously in a village, all the elderly used to sit and, especially during the afternoons, harate katte anta, they used to do that, where they used to sit and share their experiences, personal experiences. And be it not, there are sort of group therapies itself, which we are now calling it as group therapies. They are known to be therapeutic. A little planning for your future is very beneficial. Legal and financial plannings can reduce your stress from the beginning. Discussing wishes openly with your family helps you prepare and be confident. So, if you're a caregiver, maybe a person may not be suffering from cancer, but someone who is caring for people with cancer also undergo a lot of stress. You can also be, and especially caregivers are elderly people nowadays. Maybe it can be your spouse, right? It can be a husband or a wife. So mostly the caregiver also undergo a lot of problems when their wife or husband is suffering from such an illness. So it can be emotionally exhausting to be caring. Taking breaks doesn't mean that, you're not caring for them. If you need time off, for some time, it's important that you rejuvenate yourself. Meditation, support groups for caregivers are very known to be helpful. Maintaining hope and positivity. Focus on what brings joy. Stay socially connected. Interact with your friends and family. Each day is a new opportunity to find happiness. So it's all about finding meaning. I'm sure you can find real life stories you can resonate with, who have fought cancer and have lived fulfilling lives, and who have also had mental health challenges. So, a small message for the caregivers that I would want to give is that if you're a caregiver, your support is the most important thing a cancer patient can get. It makes even more than a doctor's help. The caregiver's help is more found to be important in this, and it makes a huge difference. So, if you are an elderly caregiver, it's important that you take care of yourself too, along with caring for your family members and sick family members, right? But you know that Most commonly, when people are undergoing such a huge transition like cancer and treatment, some sort of difficulties come up. But how do you know that you are having real problem? How do you know that you need to seek a help from a psychiatrist or a mental health professional? You can see you are having sleep disturbances. You can see your life is getting affected. You can see you're not your usual self. You can see you're feeling isolated and lonely, and you cannot come out of it with multiple attempts. Many number of times you start distracting, but distraction is not helpful anymore. You're going back to it again and again. When your daily life is getting affected, you know that you probably have to talk about it and seek help. Professional guidance can definitely ease your emotional distress. Final thoughts and a message of hope. You have to know that you are not alone in this journey, and life can still be meaningful and fulfilling. Small steps lead to great changes. I would like to quote one book that, if you have some time to read, is A Man's Search for Meaning. So, this is a very nice book written by a neurologist, my name, Dr. Viktor Frankl, who was caught up in a Holocaust in the Nazis' time. Okay, where Holocaust, where the Nazis have kept people captive there, and how the mental agony he went through, because he knew he's going to die that time. He would not be able to come out of it from that mental trauma. And I think that cancer somewhat invokes a similar feeling in all of us, that, cancer means death. I'm not going to come out of it. If you find that you're somehow feeling caught in this, finding meaning in everyday life is what makes your life fulfilled. Maybe not just someone who is actually expecting a death or a cancer, but even for anybody who is living. I think those people who are not really having a life threatening illness are not really having a meaningful life. But those people who are actually know that their days are counted, make their days counted by having and living a meaningful life. I suggest you read this book called Man's Search for Meaning, the classic tribute to hope from the Holocaust, written by one of the best neurologists in the world. How he has undergone mental trauma and how each thought he reframed came out of that agony without anybody's help. But by this, I don't mean you should not seek help, but it's a huge inspiration to read how someone has overcome such a traumatic journey. And with this, I conclude my today's session. Thank you for your time, and let's keep the conversation going. You can always write to me on my email ID that I have shared, and we can have a discussion here too. Thank you.
Thank you, Doctor. It was a wonderful presentation. I think more on how to, more from the psychological angle and how to handle this, more from that angle. Yes, Doctor, it's very much needed because many cases are there like that. I mean, people are suffering because of that, and practically everybody thinks that cancer means ultimate death. But,
yes.
Yeah, but one thing we forget is that after a particular time in your life, we have to be prepared for that.
Yes.
So,
yes, sir.
That from that angle, it is fine, Doctor. Thank you. But can you just, highlight any specific, tests that are available? That's, that can, to some extent, warn people and take them to a doctor for cancer. Can you think of anything like that, Doctor?
Absolutely, sir. First of all, especially when I'm talking in the elderly age group, I would want you to know that any vague abdominal symptoms, okay, don't ignore the abdominal symptoms. Like, be it, Andre, what I mean by abdominal symptoms is any gut issues, altered bowel habits, okay, little bit blood in the stools, okay, a loss of appetite, loss of weight. If you're having, it's better to have yourself examined first. Rather than an investigation, I would want you to meet a doctor who will touch you and physically examine you.
Yes, thank you, doctor. That will be helpful to us. Okay. Yeah,
Yes.
thank you, doctor. Thank you. And
Thank you, sir.
people who like to ask, they can unmute themselves and ask the question, doctor. But any specific blood test or anything like that, doctor, before that?
One thing that you can, sir, it is not very specific to any whole of group of cancers. There are specific different tests for different cancer groups. So CIA is one such blood test that you can get done, which is
Can you expand it CIA, isn't it?
hello.
Can you expand it, doctor? CIA. You said CIA, isn't it?
Can you hear me?
I'm hearing you, doctor. There's no problem. You are audible. You are audible, doctor.
Hello.
You are audible.
Hello. Can you hear me now?
You are audible, doctor.
Yes, sir.
Are you listening? Are you hearing us?
Yes, sir. Yes, sir. What was your question, sir?
Question is, you said CIA.
CEA, sir. CEA, carcinoembryonic antigen.
CEA. Oh, that's
CEA is it's not a very specific for so and so cancer, but generally we do get it done to level. It's a level of protein in the blood to help us identify if it is increased or decreased, and to monitor the treatment effectiveness of how the treatment is going on in cancer. So CEA is something that can be done.
So it is only for the person who are already into cancer treatment. But
even for even before that as well.
I see. Okay.
Yeah. And it's very important that we do it based on the symptoms that someone has. So if you have any abdominal complaints, a small ultrasonogram can be helpful to know.
Yes,
if not, a CT abdomen. So it will help us to identify. The most important thing is we don't neglect small complaints during the during this phase.
Yeah, especially when we are involved.
Yes, yes.
Thank you, doctor. Thank you. That helps. That helps. I mean, any other person likes to ask any question, please unmute yourself and ask. Doctor has given a beautiful presentation. I think.
Good evening, doctor.
Good evening, sir. Please tell me.
Doctor, sometime back, my wife had a cancer, non-Hodgkin's lymphoma.
Okay, sir.
Now she's come into maintenance. The issue, challenges, whatever we had in the family, whatever you mentioned was correct, doctor. The entire family was disturbed. I was the caretaker for my wife during the chemotherapy and all that. Now she's come to maintenance. What you said, all is correct, doctor. Thank you very much. The session is good, doctor.
I can resonate with what you said, sir, and I hope that you're doing well, and I hope that your family is doing well too.
Now she'll come to the maintenance, doctor. By God
That's
blessing.
lovely.
Thank you, doctor.
That's lovely.
Good session, doctor. Doctor, today is a good session. Thank you, doctor.
Thank you.
Good evening, doctor. My name is Sindhu.
Yes.
Good evening, doctor. My name is Sindhu.
Yes, ma'am. Please go ahead.
Weekly once I go to Rajajinagar ESA hospital
Yes.
to counsel the cancer patients.
Oh, lovely.
They're actually the main problem is many of the patients, they have sleep issues.
Yes, yes.
And especially in the case of ovarian cancer, this colon cancer, rectum and all,
yes.
Severe legs pain will be there. So
Okay.
what to do in such cases? How to, what to tell them, doctor?
Right. So, because like you mentioned, in colorectal cancer, I assume that what I have seen is it's something called as the hand-foot syndrome, where the skin and all starts peeling up. It comes out like a like another snake skin comes out. Exactly, your hands and legs start peeling out. So good massages with Vaselines and good moisturizing agents and regular massages are very helpful for pain. And using slippers that are having a huge cushion to the bottom of the foot, right? So that is helpful. And the second thing, ma'am, you said was about sleep. sleep hygiene,
Sleep,
if
yes.
sleep hygiene techniques are something that are helpful. But if you think that it is very much like if they are not sleeping even for 1 to 2 nights in a week, then it is better that they consult a physician or a psychiatrist, and a low dose of sedative can be given, like a safer modality sedative can be given for them to help with sleep.
Yes. Yes, I tell them to inform the doctor immediately, and
Yes.
also I suggest this hot water foot bath.
Yes.
Hot
Hot
water
water
foot
foot
bath,
bath.
and also breathing exercise, doctor.
Yes.
I think it's helpful, no? So I
Absolutely.
suggest.
It's helpful. I think
Yes,
you
yes.
can do that and ask them to keep their mobile phones or clocks away as much as possible in the night. If they wake up,
Okay.
they should not get to know the timing. You know, once they get to know the timing, it starts coming up like, oh, I'm not getting sleep, I'm not getting sleep. So that kind of tends to accelerate your anxiety in the night to not sleep. So keeping your phones and watches away and having a good atmosphere, dim light, cool
Yes.
temperature, and a glass of milk before sleeping, right? And a little bit of
Yes.
reading if you're not getting sleep, and going to the bed at the same time and waking up at the same time. These are some of the very helpful strategies. And if at all, even after this thing, they are not able to sleep, then we can really think of consulting a physician for a medication.
Okay. Thank you, doctor. Doctor, one
Thank
more
you.
question.
Yeah.
More question. Whether it is right. Hello?
Yeah.
Madam, only 1 second.
Yes, sir.
Dr. Mega has raised an important question.
Yeah.
I am doing residency here from NIMHANS.
Okay.
Kind of particular psychotherapy which we can go for cancer patients on palliative treatment who preoccupied with physical symptoms due to carrier's natural course. But I found most of the symptoms can be due to psychogenic also, like feeling, nauseation, and vomiting. So in such circumstances, can you think of any psychotherapy?
Absolutely. Dr. Mega.
Yeah, Dr. Mega, you can.
Hello?
Straight away.
Okay.
Yes. Hello?
Ramnath, please wait.
Hello?
Ramnath, please wait.
Okay. Thank you, Dr. Mega, for this question. What we can do is there are two aspects of the question that you have asked. The specific psychotherapy is called logotherapy, where I told about, instilling a sense of meaning in everyday life. So that is a type of psychotherapy that we use, especially in end of life and palliative care, where you know that survival is not a chance, but quality of life needs to get better. So logotherapy is the one that we use in palliative care. Second thing, as you rightly mentioned, most of the symptoms are because of nausea and vomiting. And there are a lot of medical help that is available to counter that, and also psychological strategies that can be used to overcome this. Does that answer my question?
Dr. Mega, can you come back? Dr. Mega, probably she is in the consulting room or something like that. That's why she. Yeah, please go ahead. Please go
Hello,
ahead.
am I audible?
You are.
Yeah, this question regarding I have asked because of my father. Actually, so many times he underwent endoscopy and all, but we could not find any difficulty regarding to his esophagus or stomach. But I understand this thing because his family cancer was a gallbladder carcinoma, and currently there is recurrence in the common bile duct.
Okay.
And repeatedly he was having the loss of appetite, significant muscle atrophy and all, but we tried him reassured, tried to take frequent meals even during the proper meal of like a time or the
You are
dinner.
muted, ma. Dr. Mega.
Hello.
Dr. Mega, you are on mute. Dr. Mega. Dr. Mega. Oh, network bandwidth is low. So that is the reason.
Doctor? Yeah.
Ramnath, can you raise your question, please?
Jumbo.
Please raise your question.
I want to speak to doctor.
Yeah, please raise. Hello.
That's sir.
Yeah, sir. Wait, see, Dr. Mega's network is very low. Bandwidth is low.
Okay, by the time you can take other questions.
Yeah. See, now Ramnath wants to raise the question.
Yeah.
So let him raise the question.
Muted now. So we'll take another question by that time.
Please. Go ahead, please go ahead.
Kumar is telling my question to doctor. Most of the senior citizens are susceptible to prostate cancer due to age factor. What are the primary symptoms of prostate cancer?
Okay, all right. Some of the symptoms that can come up is that a vague abdominal pain can be there, urinary difficulties can be there, okay, and it can be sometimes if the growth is very severe, it can lead to kidney problems as well. Your urinary output can get cut. Okay, these are some of the commonly occurring symptoms in prostate cancer.
Kumar sir.
Any other question?
Madam, Ramnath speaking from Chennai.
Yes, sir. Please tell me.
Hello.
Yes, sir.
Okay.
Ramnath, please tell.
Okay, now, okay.
Yes.
Oh, Sunday.
He is already hospitalized. He is talking from hospital bed. Hello, Ramnath. Please go ahead with your question.
Okay, hello, madam. I
Yes,
want
sir.
one question, important question for me.
Yes, sir.
The
Please
cancer,
tell.
which part did it start from? In the body, which
Yes.
part with easily could start from? In the breast or chest or some other parts under body?
Sir, it can come anywhere. There is no part that is restricted
What
to.
is the reason? What is the originating? How it is happening?
So
in
what
human body?
happens is that once the cells, there are cells in our body, right? Every cell is there in a body. When after some time its functioning starts to come down, right? And the body has its own mechanism to remove those cells up. Okay. So once that mechanism gets altered, those cells start collecting. They are very unhealthy group of cells. Okay. So that is how it develops. So this is
Then
one way.
in case, excuse me, madam, in case I have, whether the cancer comes, all the hair will fall down. But the only answer that cancer patient only the shaven the head. That's why I'm asking.
I'm sorry, sir. I can't hear you properly.
Madam,
Yes,
even
sir.
in the head some cancer is coming. You know,
Yes.
some are cancer
Yes.
patients only having shaven their head. How it is that? That is what.
Okay.
Then generally ladies.
Yeah, so that is coming up secondary to chemotherapy. The drugs that are given in chemotherapy. Yeah, yeah.
Like
Yeah.
dialysis is necessary for
Yes.
everybody.
Yes. So that is causing hair loss. Okay.
Okay. My friend is having that cancer in the prostate. He had
Okay.
operated in the first stage. So
Okay.
he is still having that problem. Once in 2 years he is checking. So
Yeah.
how it is happening in prostate? I'm having prostate. I'm afraid of that after seeing him. That's why I'm asking.
Okay. I understand your concern, sir. Like because your friend has also gone through that,
Yes, he's
you
my
can,
close friend.
yeah,
Same
it
year,
feels.
79. He's also same 78 or something.
Yes, yes, yes. You don't have to be worried about it. If at all
Okay.
he has it, it doesn't mean you will also have it. You feel that you have some initial warning signs, only then you need to be careful. Otherwise, you don't have to worry about it.
And another thing, madam, in the family, somebody is having it will go to other patients, other family persons or relations.
Not necessarily. One way of getting transferred is genetics, but genetics is not the only way it comes.
And
There are
my mother
many
has, my
others.
sister has, sister's daughter is having, another my
Okay.
all cousins, uncle, cousins, daughter, all 3-4 persons having in their states. But
Yeah.
they operate upon their breast. Even my sister is having
Yes.
a cut off their breast.
So
That's all.
some cancers are more prone genetically to get transferred.
Maybe CVM, isn't it?
Yeah. Some cancers transfer genetically very strongly and some do not.
How it happens, madam? Genetically means how it happens?
Means from once you have your children, there are some genes in your
Oh,
body, right?
got it.
That may get
Yeah.
transferred to them. That is how.
Oh. Thank you, madam. Since
Not a
I
problem.
dragging you for a long time. Thank you.
Not a problem. It's my pleasure.
Can I ask you a question, madam?
Yes, sir. Please go ahead.
My name is Nagaraj Rao. I'm
Yes, sir.
87.
Yes, sir.
Thank God I don't have any problem as such. I'm a yoga specialist. I do pranayama meditation every day. In fact, I teach pranayama meditation. Now, two questions. One is, I have read autophagy is one of the things that will avoid cancer. That fasting regularly, is it a fact?
Okay. And then?
Number two, the cells lose the telomere, that is the genetical one. By just increasing the breathing level, I have read that we can retain the telomere length so that the cell doesn't die even after division.
Absolutely.
These are the two questions of mine, doctor.
So it's a wonderful question that you asked. Maybe I myself need to read the second part because I'm not sure of the second part, but I can really read it up and tell. The first part I can answer your question that
Yeah.
fasting, what happens is it's generally known to have a healthy effect on you, but you need to be careful. Not for everybody it was going to be suitable. Like if you fast for 14 hours or 15 hours, I think that it has its own challenges. But what suits specifically to you and your body is something that I would recommend going about. There are a lot of studies that have suggested that it tends to have a additional effect rather than a curative effect, if I have to tell. In the sense, it doesn't cure an already occurred problem, but it can be protective. Fasting can be protective.
The record says that whenever the cell becomes unhealthy, autophagy supports that healthy cells eat up the unhealthy cells without allowing them to coagulate.
Okay.
That is what I had read.
Okay,
is it true?
Sir. I need to read about that and I'll check that. I might not be aware of this aspect, but I'll read up about that, sir. It's a new thing for me as well. So it's something I'm learning for you, from you.
The second point, I can quote the reference. I don't have it right now here. I can send a mail to you.
Okay.
One scientist has confirmed that deep breathing increases the cell respiration activity in the body, resulting in not losing the telomere length despite breaking up into two.
Okay.
Division.
Okay.
That is the one I read.
Acha. It's a very interesting study, I think. If you could share it with me on my email, I would also want to have a look at that. And it's very interesting finding, because telomerase is something that is very much implicated in cancer, and we do study its effects with various other parameters in medical field. But breathing is something important. So I'm interested to read about that.
Sure. In fact, he has said that the multiple sclerosis, the myelin cover, the protein cover, normally it is lost. Thereby, the communication is lost.
Yes.
It retains that myelin cover of the protein with the deep breathing. These are the two things. I will definitely share the details.
Absolutely, sir. Absolutely. Thank you. It's a very valid and insightful learning for me as well.
So, ma'am, we'll take the last question. This is written in the chat box.
Madam, Jyoti madam, just only 1 minute.
Yes.
Lara sounds is teaching us pranayama. Can you think of any connection or cure between pranayama and cancer?
The
Yeah. See, it can
Connection between pranayama and curing cancer.
Cancer. Yeah. Is there any study on that? Any insightful learning on this, doctor?
Absolutely. Right, sir. I think that Sudarshana Yoga, and I have learned more about Sudarshana Yoga being studied more than pranayama. But like sir said, I am not sure about this aspect. Whether it will lead to cure is not, I'm not sure. Whether already occurred problem, whether will the changes be reversed back is a little unlikely is what I think. But I have not studied, but I can share some few references by going back and looking at it. And I can definitely share some aspects of research articles if it's supportive. But right now, I think cure is not a possibility with pranayama, but it definitely aids in the process.
Oh, that's thank you, doctor. We can always share that so that we can share it in the group.
Absolutely, sir. So sure, I'll share that up if I have an email ID. I'll definitely look up and share it with you.
Thank you, doctor. And I think Mega has raised. Dr. Mega has raised more questions. I mean, has added some more things. Madam, would you like to ask that question, madam? Jyoti, madam.
Yes, sir.
Dr. Mega.
We'll take this tool as last questions because ma'am have some appointment.
Okay.
So yeah, first from Megha, any kind of distraction or any other means we can suggest patients if they are feeling nauseating, vomiting in between meals, despite multiple reassurance regarding the same and using antiemetics as well.
Right. Okay. Megha, I think I heard your question about your father and his current complaints as well. So I think that this has become a loop of an emotion or a thought and a habit and an action of either nausea or vomiting. You know, the A, B, C part of the cycle is getting fulfilled here. So if not with that, I think breaking that cycle needs to look into further exploration as to what is causing it. Is it a negative emotion? Is it a thought? Right? Okay. What is being fulfilled? What is the need that is being fulfilled? And we can target it at various levels of whether the thought, emotion, or the action. Behavioral techniques can help. Okay. But even emotion and CBT technique can also be used in this if you think that the cause is psychological. I hope it answers your question.
One last question we'll take by Sindhu CN. Doctor, whether it is right to tell the patient about the diagnosis. I feel it may cause mental shock and other complications in the elderly.
So I think it's a very, very important question that has been asked by Ms. Sindhu. It again depends on a lot of certain things. So if you think that, you know, there are a lot of, if as a doctor for me, it is different. As a family member for you, it is different. There are 2 to 3 viewpoints here. So as a doctor, I can tell you that for me, as a doctor, it is important that I communicate this with my patient as to what is really happening. But as a family member, if I'm a family member for a caregiver, right, I might find it that it can lead to certain emotional impact. And if I think that it is going to cause a lot more damage to them, and if you think that not telling may help you temporarily, but over the long run, eventually, studies have said that they may find it out by themselves. So you need to weigh the risks and benefits of telling and not telling. Whether not telling is going to help you in the long run, or it's only going to, you know, close up the matter temporarily.